We begin here with a bombshell report that confirms what a lot of skeptics thought. The lockdowns for COVID didn't work. Researchers at Johns Hopkins University say the lockdowns had little or no impact on COVID deaths and maybe even made things worse. They say shutting down the country in the early stages of the pandemic back in 2020 prevented just 0.2% of deaths. The researchers writing, we find no evidence that lockdowns, school closures, and limiting gatherings have had a noticeable effect on COVID-19 mortality. In fact, they say limiting gatherings in outdoor public spaces actually increased COVID mortality because people then gathered inside instead. So think about that. The holidays and gatherings we missed or skipped, the birthday celebrations held over Zoom, or maybe driving by your relative's garage and waving. There's also the virtual learning and how it hurt the educational, social, and emotional development of our children, not to mention the economic impact. We lost tens of millions of jobs at the beginning of the pandemic as everyone hunkered down and closed businesses. Many of those jobs we still haven't recovered. Quoting the researchers again here, lockdowns have contributed to reducing economic activity, raising unemployment, reducing schooling, causing political unrest, contributing to domestic violence, and undermining liberal democracy. Bottom line, we did some back-of-the-napkin math today of all the COVID deaths in America, and we are approaching 900,000 at this point in the country. The lockdown essentially saved 1,770 lives. Joining us now to talk more about this, Dr. Brett Giroir, the testing czar under President Trump. So, Doctor, I realize this is a novel coronavirus, and we're all sort of learning as we go here. But 2+ years into this thing, have we learned now for sure the headline that lockdowns don't work?
Well, thank you for having me on. And first of all, this was a very comprehensive study. And just to be clear, it wasn't a study in and of itself, but it was a very scientific, rigorous review of the entire literature, all the studies published worldwide since the beginning of the pandemic. It was done very systematically. And you're right. What they showed was that lockdowns didn't really matter much to COVID-19 mortality. But let me just nuance this a little bit. It wasn't that the behaviors that people didn't solve problems or reduce mortality. It's when you tried to force it on people. So what the study said is if you just give people the information, they will act appropriately and do the right things. But when you impose a government-enforced lockdown, you not only didn't help, but in many cases you hurt. And that's exactly what we tried to do in the Trump administration, is provide people the information and let people make their individual choices for their families.
Yeah, that was something that I was trying to figure out the nuance in as well, Doctor, and that is, did it help stop the spread? Did it at least initially arrest the spread of the virus?
So this study didn't really deal with this. It dealt with COVID-19 mortality over a period of time. So when we first said 15 days to slow the spread, remember, it wasn't a national mandate. It was recommendations on how to do it. And we do feel, and I think the study does support, that it may have delayed a lot of the hospitalizations and deaths in a short period of time. So it didn't stop them, but it stopped the hospitals from being overrun. But the message of this study, and again, this is a study of all studies, is clear that when you have a government-imposed mandate, as opposed to giving people the options and the information, it has no effect. And let me just point out another subtlety. This showed that there was no real effect on COVID-19 mortality, but what it didn't look at is overall mortality. We know that when you lock down the country by mandate, cancer deaths, addiction deaths, suicide deaths all go up. So you had no COVID-19 benefit, but you likely had a tremendous harm to the rest of the public health, and that study didn't even get into that.
Right. Let's show you one part of this study, Doctor, because there was an area, and I dug through this thing, it was pretty deep, you're right. The only area that seemed to have some effect from the lockdowns was the closing of non-essential businesses, and particularly bars, which does make sense because this is a place where a lot of people gather indoors.
Yes, and if you remember under the Trump administration, and I'm not saying we did everything right, but the only thing we really suggested closing or limiting the population of was indoor crowded bars and restaurants, and particularly bars. And this study does show that, and it was a pretty significant effect. Don't close schools, don't impose limits on gatherings. When you do that, people just gather in their apartments and you get twice the transmission. don't close borders, don't do all those silly things. But there was an effect in this study, particularly on bars. And we know that's a very special place. Look, I'm from New Orleans. I love a good bar as much as anyone, but you have to take it from inside, crowded to outside during the peak of the pandemic. I think we're in a different situation right now, of course.
Let's play some, Doctor, of what we've heard over the last year plus about what we should be doing. Here's some of that. Doctor, and I think you're on the same page with me on this. Critics are going to see this and say, well, see, I told you, they didn't know what they were talking about. The next thing you know, they're going to tell us we didn't need these vaccines.
Yeah, I think we really have to be careful, again, because the recommendations that people said, like try to stay out of public crowded places, particularly early in the pandemic when there was no vaccines, there was no countermeasures, those activities did help save lives. The difference in this study is when the government tries to impose it and doesn't let the people and families make decisions for themselves, it's counterproductive. So I think that's a very important point. And look, vaccines, they are not perfect, but we know that vaccines do prevent mortality. Natural immunity is very important and is as good or better than 2 vaccine shots, but neither natural immunity or 2 vaccines are very good against Omicron. It's always a good idea to get boosted to protect you from getting infected. All
right, before we let you go, Doctor, if there's a pandemic, let's say 5 years from now, a global pandemic, what's the first thing we should do? What have we learned here?
We learned a lot, and I spent a lot of time thinking about that. Number one, there are a lot of things we could do to prevent a global pandemic, and that is better international oversight and regulation on common ground of BSL-4 laboratories, like the one that probably was the origin of this pandemic. There is a lot we need to do in this country. Our surveillance system is archaic. I think the CDC has many great people, but the organization needs a complete overhaul. The CDC is no longer operational and no longer capable to lead the response. Finally, most importantly, I do think we need to have an ongoing public-private partnership. I think one of the best things that President Trump did and the Trump administration was engage the private sector. This was not a federal government solution. This was a private sector, academic sector working together. We can't build those on the fly. Look, there's a lot of things we need to do. It is not as easy as just changing the president or getting a new political party in. We have hard work to do. I think there are clear ways forward, and I'm anxious to help. I've never been called by the Biden administration since they took office to help create those plans, but I'm always anxious and would love to do that to prepare our country for the next pandemic, because there will be one.
Those are strong words, Doctor. Quickly, we're out of time, but what should we do if you don't think the CDC is capable?
Well, I think the CDC needs to be revisited, right? The CDC can't be in charge. It has to be at a much higher level, because this is not just about controlling the infection. This is preserving our liberty, our economy, mental health, all the things that need to be done at a higher integrative level. And secondly, the CDC needs to become operational. It has become non-focused. It's become, quote, academic in the bad way, that they're interested in publishing articles, but they're not as operational as they should be. There are ways to fix this, but the CDC does need to be fixed. They are a treasure. They're an American jewel, but we need to sort of reorient them to be the CDC of the old, and they're not there now.
Dr. Brett Giroir, former White House testing czar. It's always good to have you, sir. Thank you for the time.
Thank you.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.